Does hormone replacement therapy increase your risk for stroke? I'm Dr. Leah Kroll. I'm a triple board certified neurologist, stroke neurologist, and lifestyle medicine specialist. And I'm so excited to talk about this because the relationship between HRT and stroke is one of the most oversimplified conversations I see happening on the internet in the menopause space. So let's break it down. First of all, a lot of the online chatter about HRT is very polarized or black and white. Hormone replacement therapy is all good or it's all bad. And of course, that's not true. It's so much more nuanced and complex than that. And it's really individualized. In terms of stroke specifically, the scientific evidence does tell us that for women who are taking HRT, while they're on HRT, there is a modest increase in the risk for stroke. But, and this is a huge but and very important to understand, for the vast majority of women on HRT, the absolute risk for stroke is still extremely small, and that relative increase in risk really isn't significant. So, who does this really matter for? What we know from the evidence is that women who are older when they start HRT, who are more than 10 years removed from the onset of menopause when they start HRT, who have certain high risk profiles for stroke, they are the ones who are most impacted by this potential risk of stroke with HRT. So let me first start with the timing of it all, because this is one of the most important pieces of this conversation. Women who start HRT over 60 may have a higher risk for stroke with HRT, whereas women who started under 60 are less impacted by that increased risk for stroke. Women who start HRT greater than 10 years removed from the onset of menopause may have a higher risk for stroke with HRT, whereas women who start it within 10 years of the onset of menopause are far less affected by that increase in risk for stroke. So that's one piece of this puzzle. Another important piece of the puzzle is the route of hormone replacement therapy. So we know that pills are associated with higher risks for stroke, cardiovascular disease, and blood clots, as opposed to transdermal HRT. That's the estrogen patch. So that's why a lot of menopause specialists are favoring transdermal HRT or estrogen patches for a lot of women. It's a much lower risk if you're somebody who does have to worry about that increased risk for stroke. And then finally, let's get into the risk profile. So women who have a history of significant heart disease, stroke, or blood clots, they may be at a higher risk for stroke with HRT. That may give us pause. Women who have uncontrolled vascular risk factors, like they're actively smoking, they have blood pressure that's not controlled, their cholesterol is very high. That's another group that we may have a more in-depth risk and benefits discussion when it comes to starting hormone replacement therapy. So all of this comes together to kind of inform the best decision for you. Look, if hormone replacement therapy were easy and risk-free for 100% of people, it would be available over the counter. But there's a reason why this is a prescription medication that needs to be given to you by a provider who is specialized and trained in prescribing HRT. You want to be able to have a thoughtful discussion with your doctor about whether this is right for you and the best way to take HRT. So I think asking yourself, is hormone replacement therapy going to increase my risk for stroke? That's really trying to get at a very complicated issue with a question that's probably too simple to get at all the layers of it. A better question would be, is hormone replacement therapy right for me as an individual with my risk profile at this specific time in my life? And if I am going to do HRT, which form would be best for me? These are the kinds of really smart, really helpful discussions you can have with your doctor to make the best decision for you and your life and your health. The bottom line here is that we don't need to cast HRT in black and white terms. We don't need to fearmonger about it. We need to approach it thoughtfully, carefully, and with a lens for advocacy for women, because no woman should be denied HRT if she really needs it. It's all about taking into account her individual set of circumstances and her unique health profile so that we can make the best choice for her.